Hello, welcome to Dr. Chan's Minor Ailments Forum again. And since I've been talking about, plantar fasciitis earlier on, I thought I might just stick with the foot theme and talk about something related to feet. So I'm going to talk about plantar wart, or what we normally call verrucas. Okay. So this is once again very common, and we do have quite a lot of patients coming in asking, I've been having this problem for quite a long time. Is there anything else that you can provide to kind of treat the problems? And we said, yeah, loads of things you can try, but somehow we realized that they haven't actually heard of quite common treatments that you can do at home, before you come and see us. So I thought, I'll spend some time talking about what is verrucas, how it come about, how do you get it, and how to treat it. Okay, so warts on its own is basically caused by a virus called human papillovirus. Okay. Extremely common, warts come and go, and quite a lot of the time usually it clear without any treatment at all. But saying that, sometimes it lasts longer, and hence we have got different kind of treatments for you. Okay, so verrucas on the other hand is still warts, but is specific at the feet really, and they tend to be flatter just because that we walk on our feet all the time and they get trodden on and they get flatter. When compared to other warts, for example, warts in your hands normally come up like a dome. It's not necessarily being seen like that at the feet. Okay, so verrucas on its own, it affects about 1 in 10 people at any one time. So you can see how common it is. So how do you contract it? It's basically through, for example, someone who's got verrucas already walking through the swimming pool washing area, and then you walked in without any shoes on, and you've got a tiny broken area on your skin, and that's how you contract the virus itself. Sometimes if you've got a wart on your fingers, you might actually spread it to other parts of your body naturally. So sometimes it's worth treating, especially if you've got multiple warts on your body. Okay, so things that you can do to reduce the chance of contracting this virus is, one, if you do. So we're going to talk about how we can prevent getting verrucas, and if you do have it, how to stop spreading it to yourself and to other people. Okay, so number one is personal hygiene is most important. If you do have verrucas on your feet, you need to make sure that you change your socks every day. And if you're keen swimmers or you share a bathroom with other people, you might want to consider wearing flip-flops, especially in public area, so you won't transfer your virus onto the water where other people will be walking on it. And if you do swim, please consider wearing waterproof plaster onto the verruca area, so prevent other people contracting it as well. And generally speaking, 3 in 10 warts or verrucas will generally go away without any treatment within 10 weeks. However, some might take a bit longer, but most will be gone within 1 to 2 years. So if they persist for a long time, or they are spreading to other parts of the bodies, then obviously we've got medications for you to try out. So the most common one is a salicylic acid. So it's a cream or a gel that you put onto area every night. It tends to take quite a long time to get rid of the verrucas themselves. So you need to apply it on clean skin. So you might want to wash your feet first at night, and then apply it on dry, clean skin, and considering filing down the hard skin every week, so that the medication can actually penetrate through to the verrucas properly. So if that is failing to work, then we can also do cryotherapy, which is freezing off the wart for you. But people think you do it once and it'll go away. That's not true. It generally take several rounds of sapping. So personal experience, I would say maybe 2 or 3 rounds, but you can't do it too closely. So you have to leave it a gap of around 6 to 8 weeks before each treatment, because obviously freezing around the wart is alright, but the skin around it might get irritated, so you need to give it time to recover. So generally that's a nutshell of plantar warts or verrucas. So hopefully you find it useful. And also, suddenly thinking about it, that's another method that you can get rid of the verrucas themselves, is duct tape. Okay, no, you didn't hear it wrong, it's definitely duct tape. There's been a study done recently, and they show that if you stick a duct tape onto the wart or the verrucas themselves, in a roll for 6 days, and then you leave it off for 1 day and repeat the whole process again, the warts tend to die away within 1 to 2 months. They think that it's likely related to suffocation of the thymus because they can't breathe. But it's definitely worth trying, and is, you know, extremely cheap way to get rid of verrucas or wart. So give it a try and see how it. So yeah, give the above methods a try to get rid of the verrucas yourself. And if you've got no luck, not getting anywhere, come and see your GP or come and see me. We'll get it sorted out for you. All right, take care for now. Bye bye.